Welcome to the Security Speakeasy show, where we talk about all things network security. Today, we're going to discuss the findings of the Frost Radar report on healthcare IoT security in the United States. I'm Prerna Shankar, Product Marketing Manager for Medical IoT Security here at Palo Alto Networks, and I'll be your host for today's episode. I'm thrilled to be joined by Delfina Huergo, Senior Market Research Analyst for Frost and Sullivan. In the recent Frost Radar report that Delfina authored, she analyzes the healthcare IoT security vendor landscape in the United States and shares insights on the trends influencing the market, as well as best practices for healthcare organizations on what to consider when selecting a cybersecurity vendor. Hi, Delfina. Thank you so much for joining us today.
Hi, Prerna. Very nice joining you as well. Very happy to be here.
Thanks. So, Delfina, IoT security has become a top-of-mind concern for healthcare organizations. As your report notes, connected medical devices are enabling innovative new business models in healthcare. What are some of the key trends that you're observing in the healthcare industry when it comes to the usage and adoption of these connected medical devices?
Sure. So increased adoption is obviously happening at the moment. We're seeing IoT devices performing critical clinical functions that weren't being used before, especially with increasing FDA clearance and of many IoT devices out there. So it's not an additional device or an additional user-friendly consumer product. It's something that we're increasingly being able to trust and depend on. And obviously, this allows for the healthcare ecosystem to expand not only on the hospital, which is the usual, what we're accustomed to, but now we are able to expand the healthcare ecosystem at the home. So we have a huge explosion of the hospital at home market. And you also have mobility access. You also have remote access. And on top of that, you have third-party access to data and patients. So all of this really grows and increases the amount of patient data out there and the complexity of the data as well.
Yeah, thank you for sharing that. So, I want to flip that over to the other side of, the trends that we're seeing. Can you shed some light on the cybersecurity implications that the increased adoption of medical devices poses?
Yes, so we've mentioned increasing volume of data, and that it's great when it comes to developing better solutions and better analytics and better algorithms and understanding our patients better, but that also means that there's this huge amount of data out there that is exposed continuously, anywhere, everywhere, by anyone. So that really makes data the number one target for cyber attacks. And obviously, because of all data out there, it's one of the one with most value. So really, we're seeing increasing attacks in the last years with an enormous increase after the pandemic. And we also have to understand that when it comes to medical devices, there's also the inherently weak security posture of connected medical devices. There's a lot of third-party integration when it comes to medical devices, and that in itself is one of the top three reasons behind cybersecurity attacks today.
And so, keeping these cybersecurity implications in mind, what have you observed the response has been from government and other players in the healthcare industry to this?
So we have obviously the FDA and government response. We've seen the FDA publishing guidelines in September of last year, September 2023, specifically for cybersecurity in medical devices. Mm-hmm. So the government is taking an approach from the very beginning of the supply chain, so pre-market, market, and post-market requirements and guidelines. And that obviously makes healthcare organizations have security as a priority right now. It was not in the last 10 years. Healthcare organizations always have to deal with budget constraints and productivity requirements. Cybersecurity was obviously on the list, but not on the top three. And now, after the pandemic and the digitalization of care, they understand that cybersecurity, above all, is a key requirement for healthcare organizations. So they're trying to see which company out there, which one would be the best partner to sort of target these FDA requirements and be ahead of any regulations that will be upcoming and will be mandatory for them to comply for. And cybersecurity vendors then, on the other hand, have a huge demand coming, which may have been there, but not as intense as before. So what cybersecurity vendors are doing at the moment is adapting and either existing solutions, or they're developing new solutions to comply with these new regulatory requirements that the FDA demands, and also to explore which solution, which technology out there is the best one to help these organizations achieve their goals and their preventive goals, to be as preventive as possible and help both the client, the healthcare organization, and the patient in the end, which is the goal for everyone, to protect the patient.
So my last question to you, Delfina, and you've already touched upon the answer to this in the previous question. What are the strategic imperatives that you're seeing for healthcare organizations to act now? As an observer and researcher of the industry trends, what would your guidance be to these healthcare organizations to ensure a safer approach to connected medical device adoption?
So first, I guess, would be the easiest way to have full visibility of your organization, what is happening, what is going on. You could think it as taking security measures for your house. You would not be able to defend your house if you have a room locked and having no idea what's going inside, or you have no idea how many rooms you got, for example, or who's visiting your house and who's coming and going. So we'd like to think all healthcare organizations have this very basic requirement covered, but believe it or not, most healthcare organizations have no idea which medical devices are being used. They have no clue if that is normal or if not. So what I would say are the first steps for a healthcare organization that they urgently would need to tackle is a complete and full understanding, right, of their software systems that they're using and the medical devices that they're using. Mm-hmm. So who has access to those medical devices, right? So that would be access management, identity authentication. When are those medical devices being used, right? So, and having a real-time understanding of when those devices are being used. So real-time monitoring, and how are those medical devices being used? Are they being used frequently? Not. What is the normal? What is the pattern? Because figuring out the pattern of usage will allow later on to understand whether there has been abnormal behavior and how easily and we can apply preventive measures and be ahead with alerts. So I would say those three of like who has access, when it is being used, and how is it being used would be the top three to tackle for healthcare organizations at the moment.
Delfina, thank you so much for joining us at today's Security Speakeasy and sharing your insights on healthcare IoT security in the United States. And thank you everyone for watching. If you like the show, please click the like button, subscribe to this channel, and visit paloaltonetworks.com.